So good morning, everyone. Thank you for joining today's forum about the brand new 2020 Kentucky Kids Count County Data Book. I'm Jessie Whittish with Kentucky Youth Advocates, and I am excited to see all of you this morning. We are recording today's forum to share later as both a video and a podcast. So we ask that you stay muted, but we are taking questions and comments via the chat feature. So please feel free to drop those in, and our panelists and presenter may address those. And if not, we'll get back to you with the answers on that. So just a note that all of the county data book materials that we're discussing today are available online, and I'll drop a link for those in the chat and also include those in the follow-up email. So with that, I'm going to turn it over to Terry Brooks.
Hey, good morning to everybody. Thanks, Jessie. As we always do on these calls, we want to thank our most regular folks, and we also want to especially welcome brand new folks to the effort. As most of you know, Kids Count is at its core a national initiative coming out of the Anna E. Casey Foundation. And every summer, Casey, with its state affiliates, including KYA, release what I consider the national report card on kids, thinking about how children are doing in 16 discrete domains. During the summer, that's the time that inevitably we talk about where does Kentucky rank? Are we historically showing progression, regression, or a status quo? How do we do when we look at Indiana or Ohio or West Virginia or Tennessee? So that's the national conversation. And then in the fall, as you know, KYA produces a state version of that national book where we take all of the indicators and disaggregate that data by county. And we, of course, hope that counties do the same thing in November and December that we as a state do in June. We want counties to look at what areas are we progressing in, what areas continue to be a problem. How do we do when we compare ourselves to peer or parallel counties? The results from this year's book, like most years, holds a lot of good news, bad news scenarios. So you'll see, for instance, that the trend line toward improved economic well-being was continuing pre-COVID. That's good news. For Kentucky to be on a multi-year improvement in that area is something to celebrate. But we also have got to remember that over 200,000 little boys and girls in Kentucky live in poverty. So we've got to hold loosely that good news, bad news proposition. As you would guess, we saw a major data challenge this year that our historic data was pre-pandemic. And so part of what we did was provided formative data that we were able to extrapolate during the pandemic itself. So we really have kind of a double lens of historic data points that we measure, and what's the situation looking like in the middle of the pandemic. My basic hypothesis from looking at that COVID-related data and the historic data is that the pandemic really didn't change trajectories, but it did amplify issues and problems. So for a long time, we know that the data revealed disproportionality by zip code, by the color of your skin, and by family economics. What the COVID data suggested was those disparities have not just been exposed, but they've been accelerated. And they also take on extra dimensions. So I don't want to bury the lead, because I know part of the conversation is going to be about the digital divide. So Kish, I'm not going to steal your thunder on that. But I just want to use it as an illustration. If we know there was a digital divide before COVID, if we're honest, that was kind of theoretical. I mean, it was a problem for some folks, but it didn't get a whole lot of play. Well, all of a sudden, the fact that 1 in 3 Kentucky families lack appropriate access, and that percentage increases around families of color, that now is a big daggone issue, whether it's for telehealth or NTI. And you see that same pattern on worrying about paying the rent, employment, health coverage. You just go down the line. So historic disparities have been amplified. And to me, that's one of the big takeaways. The other thing we tried to do in an overview was to think about, are there current data points that might be a luminary during COVID? Now, I'll give you 2 examples. For the first time ever, we included the percentage of young people in a county who carry an IEP, meaning they're a special needs learner. And we also included data on homelessness. Well, we all know that kids with special needs, much less homeless populations, are going to be especially impacted by this weird world of schooling we're in. And so we're going to continue to look at those kind of implications. So as Jesse said, the dig down deep county level efforts, you know, you're going to have to do that for homework, and it's on our website, and we want to encourage you to do it. We would encourage you to take a look at all the materials on the website for the broader thing. And we're going to be working for the next 2 or 3 weeks around kids count data, and especially their implications for the upcoming General Assembly. And, you know, the kind of thing we're going to push hard on is the idea that as an example, if you look at the kids count data, a major takeaway is that public benefits is an imperative as we enter a 1-year budget and prepare for a 2-year budget. Those kind of investments, which have always been important, become critical when you look at the data that our families are facing, especially those families by zip code, skin color, or economics that are especially vulnerable. And we want to be linking kids count data to policy recommendations in Frankfurt. Just one encouraging note, I continue to believe, and it's not just theoretical, it's because we're having conversations. I believe that the governor, Senate leadership, and House leadership share much more in common when it comes to kids, families, and budget investments than popular conversation would have you believe. So I want you to stay at it. I want you to stay involved. I want you to be part of what we're doing, because we can produce some real results for kids in 2021. Don't believe the narrative that it's going to be a food fight when it comes to kids and families. It doesn't have to be that. Final thing I do want to mention, just because it's the right thing to do, is that our kids count effort and efforts like this could not be done without partners. So you know that Aetna helps us pull off these Wednesday forums every week. Comprehensive Mountain Care, Avisa's, Cosair Charities were key players in the Kids Count initiative, and Passport Molina Healthcare was the signature partner in that. So I want to give a shout out to those external groups. I want to thank you for joining us today. Again, this is really kind of part 1 of a 2 or 3 part series. So, you know, you gotta tune into all 3 Netflix episodes to get the results. So we're looking for you for the next 2 or 3 weeks. And just last week, we said to Patricia Tenen, Patricia, your birthday, I mean, it's the big one. She's almost turning 30, is the big one, is next Wednesday. why don't you take the day off? Why don't you just celebrate life and your family? And she said, what I really, really want to do for my birthday is moderate the first discussion of the Kids Count data findings. So we always try to deliver, Patricia, happy birthday and knock yourself out.
Thank you, Terry. I appreciate that. And it's going to start off easy because I'm not going to do the talking. I'm going to turn it over to our research director, Amy Swan, who is the heart of our Kids Count project, who's going to give you an overview of the findings of this year's county data book. Amy, take it away.
Thank you, Patricia. Hopefully everybody can see the PowerPoint on the screen. And yeah, KOA is just so excited. The day's finally here. We're sharing the 30th edition of the county data book. And the Kentucky Kids Count project is so much more than just the book. And we're going to touch on just some of what's in the book, but we're also going to share with you the many other resources that are available on our website. And so in only 15 minutes, I will be barely skimming the surface of what's in the book. So as Terry said, please do the homework, take time to review the full book and see everything that it has to offer. In the county data book, we organize the data by 4 different domains of well-being: economic security, education, health, and then family and community. And so in economic security, as with everything, as Terry said, there's a good news, bad news way to look at it. So the good news is, as he said, that pre-pandemic poverty levels were moving in the right direction. That's great. The bad news is, only 3 states had higher child poverty rates than Kentucky. Almost 1/5 of kids were food insecure. And again, remember, we're talking pre-pandemic. So it'll be really interesting and probably scary to see, what the data looks like when it comes out and is reflective of 2020. And then just really quick, the data geek in me has to point out that there was a methodology change in the indicator on childhood food insecurity. And so you'll see in the book that we're no longer able to make a direct comparison to that historical data, but that data is still up on the Kids Count Data Center. In education, the good news is that we're continuing to see improvement in on-time high school graduation rates and kindergarten readiness rates. The bad news is that we are not moving quickly enough on kindergarten readiness. We still have almost half of incoming kindergartners not sufficiently prepared. And even though we have an all-time high school graduation rate in Kentucky, we continue to see persistent and significant racial disparities in graduation rates. In fact, there's a 10 percentage point difference between white and Black high school graduation rates. And Terry mentioned that we've got 2 new indicators in the book this year: the students with an individualized education plan and the student homelessness. And that was due in part because, as you may know, there was no K-PREP testing done in Kentucky last school year. And so we weren't going to have updated data on those math and reading proficiency indicators that we usually put in the book. In the health domain, the good news is that we continue to see huge improvements when it comes to teen births and proportion of mothers smoking during pregnancy. We have record high insurance coverage for kids. Unfortunately, low weight births remain stubbornly high in Kentucky. And when you look at kids who have health coverage, we have a significant coverage gap for Latinx children. So we've really got to ramp up our outreach and enrollment efforts with that specific population. I also wanted to note that we do have older data for young adults that have health insurance, but we chose not to use that as a baseline in the book because there's significant overlap between those timeframes and the latest available data that we're able to portray. In the family and community domain, we talked about this every year because it's been a really steady decline every year for quite a few years now, that the highlight is the continued steady decline in the proportion of youth incarcerated in the juvenile justice system. The bad news, however, is that even though those numbers, that percentage has been declining, we continue to see really pervasive racial disparities throughout the entire system of juvenile justice, not just youth incarceration. So we need to find a way to close those gaps. And we could spend a whole day talking about that, but we don't have time. So I just want to point out that also really the only other area other than that stubborn persistence in low weight births where we see negative trends for the state are persistent increases in the number of youth in foster care, and fewer are being reunified with parents when they exit foster care. We are going to, moving speedily right along, skip to the essay that's featured in this year's county data book, and Terry mentioned this. It's about facing what we call dual pandemics of COVID-19 and systemic racial injustice. And before I say anything else about the essay other than the title, I want to stop and give major thanks and credit to my colleague Tara Grisham-Goodwin, who took on the challenge of covering those two huge topics within just 12 pages. I know it was not easy, as well as Dr. Kish Cumi Price with the Louisville Urban League, who we have as a panelist here today, and Karina Bareilles with La Casita Center, who was part of our virtual press conference yesterday morning, because they both provided really invaluable input, and the essay is much, much stronger for it. And the COVID-19 pandemic, it's obviously impacted all of us in some way, and large numbers of families in very harmful ways, whether that's health-wise, financially, or educationally. But the data makes it clear that people of color have been disproportionately negatively impacted. And this is unacceptable, obviously, but it really shouldn't come as a surprise given the systemic inequities throughout our culture and our institutions. And I'm sure everyone has seen some data on COVID case numbers, COVID cases, positive, tests and deaths, and heard that people of color are overrepresented in that. And that information is very important and sobering, and it is included in the essay. But we know that even when the virus is brought under control and hopefully, fingers crossed, eradicated, there will be long-lasting consequences on child and family well-being. And we are very fortunate that the U.S. Census Bureau began doing an experimental survey during the pandemic. It's called the Household Pulse Survey, and it's tracking how families are being impacted. And we used a lot of that data in this essay. And so these two charts are just two of many data points from that survey. The survey is actually still ongoing, and I've just found out that it actually will continue to go on throughout next year, which is great news because we need that real-time information on how families are being impacted. And so these two charts are actually showing data that were collected during June and July of this year. And I think that they really illustrate well that fact that both large numbers of families have been hit hard and families of color are being hit hardest. And so on the top, you see that more than half of Kentucky households with children reported losing income from employment since the pandemic began, and more than a third expected to lose income in the month ahead. Those are just, kind of jaw-dropping figures to me. But then you move down to the bottom and you see that only 60% of Kentucky adults in households with children reported being employed in the past 7 days. And you look at the racial disparities and you see that less than half of Black households with children reported having employment in the past 7 days when they were surveyed. Again, that just, my jaw just kind of drops to the floor when I see a figure like that. We also have a number of pages throughout the book that take a deeper look at some of the many issues raised throughout the essay. So for example, in the education domain, we look at internet accessibility and quality. As Terry said, we've got a panelist, Dr. Kish Cumi Price, who's going to talk about that today. And it has become even more critical during the pandemic, both for student education, but also for parents' employment and healthcare access. Terry mentioned telehealth, which has skyrocketed. We have a data point on that in the essay. And so here we see a chart showing the percent of students ages 5 to 17, so the school-age students who lack a computer, broadband internet access, or both at home. And this is 2018 data, so again, pre-pandemic. So we saw that there was already, this digital divide. And as we know, that has had some disproportionate impacts for students of color. You see that in the data there. And then in the health domain, we looked at some of the ways that access to healthcare has been impacted. And so here is a graphic that's showing the percent decrease in the number of children receiving routine vaccinations. So this is not, obviously this has nothing to do with COVID vaccinations, which we don't even have access to. These are routine vaccinations for things like, measles and mumps. And this is the difference between children receiving those routine vaccinations in the April through September time period of 2019 versus the April to September time period of 2020. And so you can see that all age groups, have really been hit hard. And there's a lot of understandability behind that. There was a certain period of time where, folks were being told, don't go to a healthcare provider unless it's, absolutely necessary, or a lot of confusion about when it was still necessary to go to a healthcare provider. But, this is very concerning because we know how effective vaccinations are and how important they are for childhood health and development. The other two issues that we took a kind of a deep dive into in other sections of the book is the fragile state of the childcare sector, and we have a panelist who's going to speak about that today. And this graphic at the top is based on, I believe, 2019 data. And so again, it's pre-pandemic, and so it shows that we already had this very fragile childcare ecosystem in Kentucky, where half of everyone in Kentucky lived in what is called a childcare desert. And so basically it's looking geographically to see who has limited or no access to childcare near them. So already a fragile ecosystem, and then it's been hit really hard by the pandemic. And we also look at parental incarceration. As you see, Kentucky has the third highest rate in the nation of children who've experienced parental incarceration. And there's so much I would love to talk about that, but I am not going to let myself say anything about it because I've been told that we have an entire advocate virtual forum devoted just to that topic that's coming up soon on December 16th. So please, tune in for that. I mentioned that the book is just kind of the tip of the iceberg when it comes to the Kentucky Kids Count project. We have a number of additional resources that I wanted to make sure you are aware of. We have county profiles for all 120 counties in Kentucky. And so there you're going to be able to see how your county, or when it comes to the education indicators, your school district ranks on each of the 17 indicators featured in the book. You're going to see that baseline data that change over time. We have the Kids Count data dashboard, which is interactive. And I wanted the thing to kind of know about the data dashboard, in my view, the most important aspect is that it's going to enable you to see the state level data for these indicators in the book disaggregated by race and ethnicity. So please check that out. We also have a relatively new web page at our website, and I've put it up there, that has a wide variety of race equity resources. And so there you're going to be able to find you're going to be able to see which specific indicators on the Kids Count Data Center KYA has made data disaggregated by race and ethnicity available for counties and school districts. So please check that out and know that that is something that we want to continue building on throughout this year. We've started with, you know, I don't know, about a dozen or so, but we want to keep building that out. And lastly, of course, there is the Kids Count Data Center. You know, in the book, we only have room, so to speak, to feature 17 different indicators, but there are approximately 100 different indicators of child and family well-being on that Kids Count Data Center. And so we've got the address to that there as well. So that was an incredibly quick run through of this year's Kids Count project, because I want to hear from these panelists. You know, they're going to bring the data to life through that discussion. And so just know that the other resource that we want to make sure everyone takes advantage of is us, KYA staff. And so please, please feel free to contact me if you ever have any data questions, whether it's about the data that we've talked about here today, or any of the data that we have on the Kids Count Data Center, or just data that you're having trouble finding and want to know if it even exists for Kentucky kids. Thank you. I'm going to kick it to Patricia now.
Thank you, Amy. And I encourage all of you to take Amy up on that. I think you can see she puts a lot of passion into this project for many years. And she also takes great pride, I think, in being, I think, one of the state's top experts on the sources of good, reliable data on child well-being. So please do reach out to her. And thank you, Amy, for all of the work you've put into the project. And now it's time for us, you know, the mantra of the project itself is what gets measured gets changed. And so we firmly believe that the point of having this data is to inspire action. We know at the federal level and at the state level, but also at the local level. And so I'm really excited to have a conversation with our panelists today to get your input on how do you see the data playing out in your community, and what are ways that advocates should be focusing our action. So to introduce our panel, we have Dr. Henrietta Bada, who is the Director of Maternal and Child Health Division at the Kentucky Department for Public Health. Welcome, Dr. Bada. We also have Mike Hammons, who is the Senior Director of Advocacy for Learning Grove, which is based in Northern Kentucky, an early childhood juggernaut, how I describe it. Dr. Kish Cumi Price is the Director of Education, Policy, and Programming at Louisville Urban League. So we're excited to have all three of you here today. So I'd like to start off first with raising the theme that Terry introduced and then Amy kind of expanded on about the dual pandemics of COVID-19 and racial injustice. And I'd like to hear from each of you how you see the data in the book reflected in the kids, families, and professionals that you work with. And I'm going to open this up to anyone who'd like to start us off.
Well, Patricia, I'll start, but at Learning Grove, we serve children and families, not just in childcare, and childcare is an important support for children in preparing them for kindergarten, and it's an important support for working families. We had to close, obviously, back in March and weren't able to reopen until June, except for limited childcare for essential workers. That was a huge challenge for so many parents who still needed childcare, whether they were working outside of the home or inside the home. So we had to learn to adjust to reaching out to them and providing them services virtually. Many of our families we serve too with family outreach programs where we provide food and support. all that increased. They didn't come to the centers to get that, but we had to reach out to them and go to their homes and neighborhoods to provide those services. Our teachers also were strained. This is often referred to as a she session, and childcare teachers are low wage, unfortunately. I mean, we try to be competitive at Learning Grove in a difficult economic environment, but teachers still struggled. Now, we were able to keep them on the payroll thanks to the CARES Act and to the federal relief, but they still had the same challenges of trying to meet their rent and support their families with not having access. Maybe their spouse was no longer employed, so that was a problem. We also do outreach to families. We're part of the home visitation program, the Hands Home Visitation Program, and we struggled there because trying to apply telehealth measures to our visits. We couldn't do in-person visits, but we continued to try to expand the use of telehealth and virtual visits. And we made some progress, but there were some challenges there as well.
Thank you. And I know, Mike, we've had this conversation a lot. It almost as if the lack of investment in the system of public investment in childcare, a lot of that weight falls on the early childhood workforce, who is underpaid. And we know that there are a large percentage of our early childhood workforce are women of color.
Yes, exactly.
Comes out in that manner. Dr. Price, Dr. Bada, how are you seeing the dual pandemic playing out in your sector?
Yeah, in the area of maternal and child health from the Kentucky Department for Public Health, you have additional effort switched to the pandemic to make sure everybody's informed of what's going on, to the point when some of our personnel actually are helping with that. However, our programs have to continue. And the pandemic and the ramifications from it, the loss of employment, increase in drug use, the food insecurity, issues with schools, children getting the education, really has put a barrier to a lot of our programs. And we see the disparities more as a result of the pandemic. For example, when you're dealing with a home that is our families affected by substance use, and there's issue with employment, with food insecurity, it creates a lot of tension in the family. And so you have children being exposed to more adverse childhood experiences. And we know that childhood experiences are risk factors for poor health, poor outcome into adulthood. So earlier in the year, we were saying, we have to have more improvement in our maternal and child outcomes if we can actually direct our effort to addressing the social determinants of health, the poverty, the access to care, and all that. And then we have the pandemic, and everything just gets aggravated. So, but we are trucking along and continuing to provide the services. The issue of the broadband need, the internet, is really has helped us in one way because we are able to reach some of the families, but not all of them. You're talking about IEPs, the children with special healthcare needs. We oversee the early intervention services for these children. And to provide that by tele-intervention is really very difficult. And some families are not happy with it. And really it depends upon the needs of the child. So we were prepared to maybe starting the face-to-face intervention until, we have the red zone again increasing. So we have to put a hold on that, but continue on with tele-intervention. One thing that may have maybe the good point is that we had a waiver from the federal government, from USDA, of not requiring families to have a face-to-face interview or to sign up for enrollment to the WIC, into the WIC program. And so that really helped. They can do it by phone, and then they can get the assistance that they need for the pregnant woman, for the mothers, and for the children. So our enrollment, at least to the nutrition program, has remained the same, if not increased. So that's one good thing.
That's
and
wonderful.
one lesson learned is to be able to use the virtual access to a lot of our families, not purely virtual access, but to complement the face-to-face and the home visiting programs and other programs, so that we can increase the number of mothers and children or families that we can reach. So that's really where we are. But as I said, we'll keep on doing what we can do amidst the issues with the pandemic.
Yes, thanks. And I think, there is a graphic in the book that shows how dramatically telehealth visits have increased during the pandemic, which is, I think, no one would argue, been a silver lining, that we have expanded dramatically in that regard really quickly. But yet I think there's lots of room for growth. It's been big, but I think we still need to build that out. Could you also talk about we saw there were gaps in health coverage, despite, record numbers of kids insured, kids covered, we still see gaps for our Latinx children. I know there have been mention of recent efforts by the Bashir administration to close those gaps. Could you speak to efforts that are ongoing there?
I think we don't have we have contracts with the universities, for example, University of Louisville, University of Kentucky, to reach these families, especially the Latinx families, and they see them and they provide case coordination, care coordination. But I think we can, I think we should be able to expand that. Most of our information, they're sent out English and in Spanish, so that's also helpful. But I think we can really do a much better job with that. I know there are some agencies around that are helping these families, but it should be one of those things that we should work on. And really, the epidemic has highlighted that these are the families that are affected. And you mentioned earlier the loss of employment, and that's again another issue that these families will have to contend with.
Thank you. Dr. Price, I'd love to hear from you, your perspective from the Urban League about those dual pandemics and how you're seeing them play out.
Absolutely. First, I just want to start by saying thank you all, KYA, for your hard work, to the sung heroes as well as the unsung heroes. I had a glimpse of what goes on behind the scenes work. So we appreciate you all producing this and being able to give a depiction of what we are seeing in real time. And it's not a pretty picture. And I think we have to continue to sit with and understand that this was a problem beforehand, right? So acknowledging that, and then acknowledging that it's getting worse. That is not just what we see in the graphics, is what took place prior to right now. And we are seeing, with the numbers spiking, with all of the trends going in the wrong way, wrong direction, we're looking at how we can best support families right now who are in what I would call crisis mode, crisis upon crisis upon crisis. And so one of the strategies that I think has been really helpful when we talk about the digital divide, we know that there's multiple layers of that. Do you have a device? Do you have connection? Do you have good connection, right? Because now that we are in this remote learning space for students, it's not just about being able to get on the internet, it's being able to log into a classroom, a virtual classroom, very much like what we're in today. And the bandwidth to support that is a lot, right, for a student. Then imagine multiple students at the same time in a household trying to do that, as well as focusing on what's going on in your particular classroom. We have tried to assist with getting headphones for families to be able to help out with that piece, but there's still a lot that goes into, you know, learning from home. And when you talk about the digital divide, we're not just talking the device, we're not just talking connectivity, but we're also talking tech support. We're talking learning curves. We're talking learning fatigue. So Kentucky ranks at the top for grandparents taking care of kids. And if you think about how comfortable parents are with helping their kids as well as grandparents, and it's a lot. And so we do not believe that right now there's enough support for our families to help them through this. And on top of that, if you are concerned about keeping a job, having food on the table for your family, understanding where the next meal is coming from. And I agree that it's great that the USDA was able to shift how they do things. And we were all panicking when we were thinking that the meals were only going to be for students at the schools and not, you know, for some of the younger kids in the family. So we're grateful that that switch was there. But there's so many pieces that play into this, and we believe that the community learning hubs help mitigate some of the issues, but there's a lack of spots or vacancies at those sites, and there's a lack of sites in general, and money to support those sites. You know, we've had an outcry of from parents saying that they need support during the day, and a lot of people see that as questionable. Well, that, you know, isn't that just daycare? Guess what? Right now, daycare is whatever you want to call it. We need that, and we need more of that, right? And so supervision for kids while they are working on their academics during the day is very necessary. And I'm really afraid of what we're going to see in the days and weeks and years to come when we talk about data trends as to what this means for our kids moving forward and our families.
Yeah, thank you. That phrase, isn't that daycare? As if that's you know, I think there's nothing we've learned more than how essential daycare, childcare is, you know, and the roles that schools played in terms of having, that space, not only where kids are learning, but they're safe and they're tended to, because let's face it, us working parents rely on that. It's essential to the system. So thank you. I was glad you raised the community learning hubs. That's something I'm very curious to know more about. Do you know, are these kind of hubs also beyond Louisville? Have you heard, is this kind of a statewide thing that's going on? Is that something that just the Urban League is working on here? And tell us a little bit more about how those work.
Absolutely. So I'll start with, I guess, how they work. So the community learning hubs that we have here in Louisville are really out of school time providers, some churches that knew there was going to be an extreme need for support for families with the remote learning being required here in Jefferson County, and rose to the challenge to provide for families, not just extended day services that they were normally providing, which were after school, but throughout the day. And so it looks different depending on which site you go to, but they try to adhere to the CDC guidelines and ensuring that there's a 1-to-10 ratio or less, to basically have these pods within each site, and working with students to get logged into classes, to participate, trying to help with instruction. And so that's a heavy lift for folks who have been operating in a different capacity, providing, extracurricular activities. They're not necessarily educators. Some have educators, some do not. How we folded into this is back in June, we reached out to the district, the Louisville Urban League reached out to the district to say, hey, we think this may be an issue for families if the option is to be at home, schooling from home when the school year starts. And we see it as a big equity issue. Is there a way for the district to support community learning hubs, this concept of those who are going to be learning in community at various sites, whether it's an out-of-school provider, a church, a community center. And so we started with the advocacy piece and connected with Evolve 502. We were already working with them as a part of their rapid response team. And so they really took the charge of having those partners that were already at the table to sound the alarm on this and say, how can we better support this initiative and ensure that kids are getting what they need? The issue is that I think our vision was that this would grow and become more of a city state model, where we would embrace the idea and the notion that there are a lot of families that are going to be in need of support, and how can we open up various sites throughout cities to support and stand up these models to not only provide supervision, but actual academic coaching as they're at these sites, and some extracurricular to the day, some social emotional learning and support that students would need, wraparound supports for families. And so it's happening beautifully at some sites and at others needing more support, but we definitely need more funding to support this, because at our count, we have probably 1,500 students that are able to take advantage of this, but so many more on waiting lists. I can't even count at this point. Wow. So we really need help. And there are states that are doing this. There are cities where, the mayor has taken the charge and put forth funds to support. Our mayor has now, I don't want to say finally, but he has stepped up to do that and provided some of the CARES funding to support. And the district has provided substitute teachers to help with some of the sites. So it's a heavy lift. It's a slow lift. I want to go much faster than in my mind's eye, this would have moved much faster if we understood the urgency. But sometimes it's slow moving the train.
Right. Yep. Well, thank you. And I think it's innovative and it's responding to a need. And I think sounds like there's still room to grow and room for improvement. But I'm glad to hear that work is being done, and thank you for taking the reins on that, because I agree it's super important. So I think it sounds, we've already heard an example here from Dr. Price about an innovative solution, because I think that's what this crisis demands, is innovation kind of at warp speed. So I'd like to hear from you, Mike, and Dr. Bada. What are some innovative solutions that you've seen during, be that policy or practice, during this pandemic that we should be lifting up? And what are some changes that still need to be undertaken? So I'm going to throw that out to either of you.
I'll only add that meeting with parents and teachers and clients through virtually has been very important. And I think we all learned a lot quickly, but there's still much more to learn. And I think trying to make sure that the regulations keep up with the potential that working with people remotely provides. So I think that's been one of the most important. Another bright spot that's the community came together very quickly in Northern Kentucky, foundations and businesses and individuals to reach out and try to provide support. So they were providing laptops and iPads and food and diapers and PPE and support for families. They came about very quickly. Agencies partnered very well together and very effectively, I think, in identifying families that needed help and helped get them that help. So I think the whole working from home has been innovative, and we're doing professional development more online. We've embraced technology a whole lot more wholeheartedly, and I think we're better positioned after this pandemic to maximize that, leverage that going forward to more effectively serve our clients.
Thank you.
Okay, in Eastern Kentucky, we started a project that we thought was, it was innovative until COVID came along, and it kind of put a dent in that program. But it was similar to your community hub, but it's focused on mothers who are using drugs, and we try to approach them when they deliver, so that they can come to the local health department and get the parenting classes, which is really strength-based parenting, and they can have a peer support group as well. And there's an hour session on how they can access community resources, and also a session on social emotional socialization and emotional learning. And it's good because they have to bring their child with them and their kids, especially the baby, so that then we can promote the interaction. And I should say it's like a community hub, because it started to be a place in the local health department, but there was the church next door. And the church next door contacted the health department saying, well, we've got a nice place in there. There's nurseries for little kids. And also a playroom for the older kids. So why don't you just come and use the church? Be at the church. So that's exactly what happened. And we felt bad because they didn't want us to pay. But they said, okay, we pay. You can pay $50 a month and you can use the facility. And so it went on and really went very well, to the point where our mothers have really, have recovered. Mm-hmm. And but they wanted that socialization. They wanted the face-to-face with the other folks having the same problem and try to, help each other. So it went very well, and we said, oh, this is really highly innovative. But then when COVID came along, then there were the barriers of not being able to come to the church or to the health department. And we tried FaceTime or Skype and all that, and to a point that we actually pay for the internet fee so that they can continue with this hub of socialization. And that's where we are right now, but I'm hoping that it can be replicated. And in fact, we were ready to replicate in another health department, but we have to put everything on hold, the training and everything else. But I think if we can continue that, I think we will have better outcomes for these families and their children. And in fact, some of the mothers were saying that after they have been in the center in once a week session, I said they came home and they're able to deal with the other kids much better, and they're able to deal with their partner much better. There's better communication. So we will continue with it and the best we can, and hopefully find some other solutions to overcome the barriers. But most importantly, this program actually helps in, you mentioned one of the issues that was brought up is the number of children in foster care. And this has become like a site for the moms whose children are supposed to be in foster care. The foster parents come and the mother come, and that's considered by DCBS as a supervised visit, so that she can qualify for reunification within so many months. And that has happened. And I think that's really great. So we will work on it. We're working with our DCBS partners, the behavioral health partners, and everybody else. So we'll keep on going.
Wonderful.
Patricia, if we have just a second, I want to talk to, I mentioned the work we've done with racial inequality. We've had a chief diversity officer for some time, but I think the events that have occurred across the country, I think have really raised the issue of white privilege in a way that maybe we weren't fully appreciating. So we're working with that at both of our leadership team that are exploring books on white privilege and how to be an anti-racist, and another series that we've been discussing. But we're also working with our teachers to develop curriculum to have conversations in the classroom, and we're working with outreach with the parents. We will not be the same organization after this year because of what has been shown to us. It's just so critically unequal and the bias, discrimination. We must do something about it. And it's not just a matter of looking at the surface. We have to dig down deep. And our organization will be better because of all of this, and it being embraced at all levels of the organization, which is affirming and I think very promising. So.
Thank you, Mike. Thanks for sharing that kind of authentic insight into your own organization. I know we're having the very same kind of look at our own internal work and how we can do better and be part of progress, much needed progress in advocacy in this space. So there's so much more to talk about, but we are running out of time. So thank you all so much. I echo what's in the comments, and it's been really affirming to hear the examples of the innovation that's going on and that you're a part of. So we're really grateful. I'm going to turn it over to Mara Powell to close us out.
Thanks, Patricia. And thanks to our panelists, Dr. Bada, Dr. Kish Cumi Price, and Mike Hammons. We so appreciate your insights and expertise like Patricia shared. And we also want to thank Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. And as we've heard, KYA has worked with the Annie Casey Foundation for 30 years now in releasing data on child well-being because we believe, as we've heard many times, that what gets measured gets changed. And by tracking these indicators of child health and education, family economics, and well-being, advocates like you all on the call today, as well as our local leaders and our leaders in Frankfurt, are able to see areas in which our focused attention is needed to improve outcomes for all kids across Kentucky. And, from addressing the digital divide we see in both the rural communities and in our cities, to boosting a very strained childcare sector, to building on successes we've seen with community learning hubs and in telehealth to improve care and access for families. And in many ways, these are real steps to address the systemic inequities that we have seen, and gives so that all kids can have the opportunity to thrive. So thanks again for those of you all for tuning in today and your commitment to thinking about data-driven change for kids. And looking ahead, as Terry shared, we're taking off next week because of the holiday, so enjoy the break. We know we will. But be back and join us on December 2nd for part 2 of this conversation. And then on Wednesday, December 9th, as we'll be discussing the 2021 Blueprint for Kentucky's Children Policy Priorities, which will be released that week. And as always, look for that follow-up email from Jesse, where we'll share the Kids Count materials, slide deck, and links to those RSVP forms for the upcoming forums. And be sure to register to join us for Children's Advocacy Week in February. Thanks all.
Bye, everyone. Thank you.
Thank you.